My name's Deborah. I'm the research nurse looking after the PACE study. I work with Dr. Tree and Dr. Van Ness.
One of the things I've been thinking about are all the visits I'm going to have to make and what they consist of.
Well, we've got this useful study calendar that I can give you to take. We've got some pre-randomisation investigations first of all.
Okay.
And that includes taking a medical history from you.
Yeah.
The doctor might also need to do an exam to see how
Okay.
you're doing. We need to take a blood test from you.
Right.
That's for a PSA and a testosterone. We may also need to do an MRI of your pelvis and a bone scan. And we also need to take some questionnaires from you just about how you're feeling, some symptoms that you might have, and about your quality of life.
Okay.
We then will need to see you after your operation or after your CyberKnife SBRT. So whatever treatment you receive, we're going to need to see you in clinic at week 2,
Okay.
week 4, week 8 and week 12, then at 6 months, 9 months and 12 months. And then we need to see you every 3 months for 2 years.
Right.
And then 6 monthly for 5 years, and then yearly to 10 years.
Right. That is a lot of visits. Are they all really necessary?
At the beginning of your treatment, if you're doing well and everything's going to plan, we could do some of these consultations on the telephone.
Oh, right. Okay.
So that might be helpful if you're working and things.
Very good.
We need to see you this often really to assess the side effects of treatment,
Okay.
to make sure everything's fine,
Yeah.
to get a true and accurate picture of what we've done.
Yeah.
And that's it, really.
Good. So, with each of the treatments, how soon will I be able to go back to work?
If you get randomised to CyberKnife SBRT, you can continue to work.
Uh-huh.
There's 4 or 5 treatments spread over 1 to 2 weeks.
Right.
You might get some diarrhoea towards the end of your treatments, but we can give you some medication to help with that.
And I can keep working while I'm having the treatment?
Yeah, you definitely can keep working.
And how long are each of the treatments?
The treatments last about 60 minutes.
Okay, all right.
If you get randomised to receive a prostatectomy, you will need to come to the hospital for a pre-assessment. That's just checking that you're okay to go ahead with surgery.
Yeah.
You'll get an opportunity there to talk to the surgeon as well. You'll come into hospital for your surgery and you'll need to stay in about 2 days. I think that Dr. Tree explained to you, you will go home with a catheter.
Yeah, she did mention
and that can be looked after at home. And then you should be off work for a few weeks, but we always suggest that you tell your employer that you're off for about 6 weeks, just in case.
Yeah, right, as long as that.
Yeah.
And how long does the study last?
The study lasts for 10 years. We'll follow you up yearly from 5 to 10 years.
And if at some point in the study I want to withdraw from it, not continue, does that affect my...
No, you can withdraw from the study at any time and it doesn't affect your future treatment.
I mean, at the moment I can't understand really why I would do this. There must be considerable disadvantages to doing it.
We don't know which treatment's better. One treatment may be less beneficial, and that's what the study's trying to find out.
Mm-hmm.
You may experience some unexpected side effects, and you do need to come to the hospital more often if you're on the study.
Right.
So that's a bit of a disadvantage.
Yeah. So what are the advantages to me of actually doing this study?
Well, being in a trial means that you're monitored much more closely.
Right, okay. So I get to see the doctor more often?
You get to see the doctors and nurses more often.
Uh-huh.
Any side effects we pick up much quicker. Also, you're helping us to find better treatments for the patients coming sort of in the next 10 years.
Yeah.
So that's always an advantage.
Do I have to take part in it?
No, you don't have to take part in this study at all. You can have conventional treatment, that's absolutely fine.
Right.
Take your time and digest all the information and make the decision that's right for you.
Okay. And if I do decide that this is something I would want to do, what happens then?
Well, once you're absolutely sure you want to take part, we would ask you to come back and see the doctor and ask you to sign a consent form.
Yeah, no, it's been very good to chat with you and it was good to talk to the doctor, so I think I probably just have to spend a little time thinking about it.
Okay. You really don't have to take part in this study if you don't want to. We can discuss things in more detail if you're really not sure. My telephone number's in the PIS, it's right at the back. You can ring me at any time with any question. There we are.
Oh yeah, great.
That's me. We'd love you to join the study. If you do decide to withdraw at any time, it's not a problem. You'll receive conventional treatment and you'll still be cared for here.
Okay. Right. So I just need a little bit of time to think it all over.
Take time, speak to your family and your GP, sort of take time to digest all what we've told you and make the right decision for you.
Okay. Thanks.
That's okay.